It's time now for Countywide, a special presentation of Yavapai Broadcasting News. Join Paul David and Kyle Benedict as they talk with our community's leaders, newsmakers, and people in the know. You'll hear about the hot topics that affect all our lives in Yavapai County. And now here's today's Countywide.
Welcome to Countywide. I'm Paul David. Great to have you in studio today. We're going to be talking about influenza, flu shots, the flu season coming up just around the corner. Yavapai County Health Department Immunizations Manager Cherry Verret in studio. Welcome.
Thank you, Paul.
Good to see you. Thanks for coming in.
Thank you for having me.
We do the show every year. We talk about flu vaccine, and shots, and I think we'll start at the beginning. What is influenza?
Influenza is the flu. It is a respiratory infection that affects the nose, mouth, and the lungs. It is a highly contagious and viral infection.
What gives all the aches and stuff? Because I think, okay, if I've got the, my head's stuffy and stuff like that, okay, but then there's just that drain and that ache that just knocks you out.
It essentially takes over the whole body. It affects the upper respiratory system. With the flu, you're going to have fever, body aches, fatigue, tiredness. The flu, though, what differentiates it is that it's always accompanied with a fever.
Okay, all right. The fever's the key then with the influenza.
Yes, absolutely.
So I guess sometimes you can have that stuff and it'd be like a cold, but then once you throw in a fever. Yes,
and we actually put out, that's put out by the CDC, we hand out to anybody that comes in is a piece of paper that's called cold versus the flu.
Okay.
Because the signs and symptoms are essentially identical. One of the differentiating factors is the fever.
Where does influenza come from?
It circulates around the world.
Okay.
So
does it come from anywhere in general? It's always out there?
It's always been here, and it's going to stay as long as we're not all vaccinated. It's looked at right now is coming into our flu season, which is October to April.
October to April, okay.
And so during those times and then other times of the year, they're looking at the southern hemisphere to see what's circulating there.
Okay, that's what I wanted to get into a little bit with you, because we talked about this once before, but it's been several years ago, and I found it really interesting that the southern hemisphere is kind of the northern hemisphere's guinea pig, because I'll say that, you don't have to, but we're watching their flu season. We are. Okay, so how do we do that, and what are we watching for?
What they're looking for around the world is they're looking at different groups. Maybe the southern hemisphere and over in Europe, different areas. One group might have influenza A, the other might have influenza B. Now that we have gone global, as far as traveling, those are starting to intermix.
So this is a whole new ballgame we're talking about, right?
Pretty much. So
when did we start realizing that this was going to be such a different thing? Because this is the first time hearing about it.
This was actually has always been there.
Okay.
It's just with our ability to travel the way we do now. One of the main factors was H1N1 that really brought it to light.
Okay, I imagine that was probably the case. When was the H1N1, the big scare?
2009.
2009, that long ago already.
That was, yeah.
Okay.
But it lasted a good, 3-year period.
Okay.
So it never did completely stop. You're looking at a pandemic flu.
A lot of things happened.
When it's circulated.
A lot of changes happened when that H1N1 came up.
Oh, absolutely.
And you still see it. All the hand sanitizer stands all over the place. I know there's still the signs in the restrooms about wash your hands. It's got like the steps and all that are still in the washrooms.
Oh,
all that stuff is still around.
And those are great preventative measures. You want to stay with those, whether it's flu season or not, but especially during flu season. And with H1N1, we want to prevent the resurgence of that. We don't want that to come back around.
Of course, of course. So we're watching Southern Hemisphere now. Well, we're actually watching the whole globe.
Yes.
Okay, so do we know what kind of flu we're in store for this year? Can you tell me what kind of flu is coming around the corner?
Well, with the flu vaccine, what's changed is over the years, a lot of people have looked where we've had a single flu vaccine of one strain, A or B, and then we had the double, A and B. Now we have a trivalent and a quadrivalent.
Oh, wow. What's that all about?
The trivalent covers both of your A types, including H1N1 and your B, and your quadrivalent covers both types of A and both types of B.
Okay. What's the difference between A and B?
It's just the strain.
Okay. Just different strains of flu.
Different strains of flu.
Is one worse than the other? Because
A is actually your worst.
Okay, because you put the H1N1 in the A category there, so I figured
absolutely.
They're probably... Okay.
Absolutely. It has more of a potential of becoming an epidemic and a pandemic.
Oh, okay.
So it has the ability to morph.
What takes us to that point where we decide it's at that point, pandemic, epidemic?
That is decided essentially by government agencies.
Okay.
But it's what you'll do in an endemic, epidemic would be, national. We could have an epidemic, here or in Phoenix where it's just a larger than normal amount of cases.
Okay.
And then pandemic is worldwide.
Okay. Oh, I didn't know that. So epidemic can be local, pandemic is worldwide. Oh, that's interesting. Okay. So what kind of flu we got this year?
Oh, well, we're going to protect against both A and B.
Okay, so just in general, just a canvas?
Just a canvas. It's getting more difficult to pin down as we become more global.
Okay.
Where we used to, for years we would follow, the steps of, the flu. Okay, this is what's going on in the southern hemisphere.
Okay.
And so we're going to expect that, this following year. As we become more global, that becomes more difficult to pin down. So they're giving you a broader spectrum of the vaccine to cover you.
Well, I'll be darned. Okay. Have we had bad flu seasons over the last few years?
The H1N1 has been the last one. All flus are bad, though.
Okay.
So you absolutely want to get your flu shot.
Case-wise, have we had a lot each year? Or
not since H1N1.
Okay,
no.
H1N1 was the big year, and we had a lot of cases that year.
Absolutely.
Okay.
Absolutely.
Did that reach pandemic?
Oh, yes.
Okay, all right. That hit
Yes,
pandemic.
by all means.
Okay.
Yeah.
All right. So what do we, you said October through April?
October through April. The peak is generally in January.
Okay.
Most people, one of the misconceptions is that most people will wait to get their flu shot thinking it's going to wear off, and will wait till maybe December or so to get it.
Oh.
What they need to do is actually get it earlier in the season for two reasons.
Okay.
One, the flu can start as early as September.
Okay.
And two, it takes 2 weeks for the antibodies to produce in your body.
Okay.
So the sooner you get it, the better. If you wait, you're more likely to get the flu. You may get the shot, but you're more likely to get the flu in that 2-week period where your body's trying to build up the antibodies.
I know we've done stories on that in the past too, where the health department David McAtee has sent out a release saying, it's better to get it early than late.
Always.
Because I guess what happens is a lot of us probably start hearing about the flu coming up, and we're like, oh, better get that shot. You get the shot, but then you catch the flu, or you already have the flu, and the flu actually sits in you for a few days, doesn't it, before you actually feel it?
Essentially, yes. You could have it be harboring it a day before, and then still be shedding it up to 7 days after having it.
Okay, and shedding you mean by spreading it?
Spreading it by coughing, sneezing, talking.
Okay.
Yeah, let me share this with you.
Yeah,
it's
enjoy.
Type thing, handshake type thing, so absolutely.
All right, so it's better to get it ahead of time, and then, because it takes a couple of weeks for it to actually, your body to
become fully immunized.
Okay, and then after that, you're good for the whole flu season.
You are good for the flu season.
Let's take our first break, okay?
Okay.
Cherry Beret in studio today. She is the Yavapai County Health Department Immunizations Manager. I'm Paul David. This is Countywide. We'll be back in just a couple minutes.
You know what, guys? There's a lot of tree branches and dry brush over here. We should probably move the bonfire over there.
I'm guessing Smokey liked that idea.
In the 1950s and early 1960s, the United States government conducted nuclear testing in the Nevada desert. The wind carried contamination throughout parts of Arizona, Nevada, and Utah. People living in the affected areas during that time are known as downwinders. 20 forms of cancer have been linked to downwinders, and free cancer screenings are available to qualified individuals. Over $1.8 billion has been paid out in compensation by the U.S. government. Please check the Downwinders websites for more information.
Clean kitchen surfaces, utensils, and hands with soapy water. 1 in 6 Americans will get sick from food poisoning this year. Keep your family safer. Check your steps at foodsafety.gov.
There's a shelter pet who wants to meet you. Meet one today. Visit theshelterpetproject.org. Adopt.
Welcome back to Countywide. Good to have you along. YavapaiHealth.com, a good website to write down and keep handy for you. Just put in your favorites on your computer. And then a number to call for more information about flu shots and immunizations, 583-1000. Cherry Veray is our in studio today. She's our guest with the Yavapai County Health Department. We're talking about flu shots and vaccinations. You said flu season October to April, but
Yes.
do we start offering shots this month, September?
Absolutely.
Okay.
As soon as they're available.
Okay.
You'll
And when
see.
is that going to happen?
They're already available
Okay.
to a certain extent.
Okay.
We have multiple different programs, so depending on which program those come under, we have the private, which usually comes in first for most places,
Okay.
and then the vaccines for adults and vaccines for children that are provided by the state and government.
Okay.
So.
Will you guys be doing a big push this year, think, to get people to give flu shots?
Oh, absolutely.
Yeah.
We offer, at all 3 of our clinics, we have specialized immunization nurses, and we also have about a dozen flu clinics planned for the county.
Okay, all right. That's the clinics. I know David McAdee will send me a list of those clinics, and then we start announcing those as soon as we get those.
Yes.
But I kind of figured September, that's about flu season. It's the kickoff of it, at least. And yeah.
Essentially, yes. And,
have we seen any cases yet?
no.
No.
No,
Okay.
not that I have been told at this
Okay.
time.
Well, that's a good thing.
And all of our clinics are so far being scheduled in October.
Okay.
Just to ensure that we have adequate supply of the flu.
Now, do we have adequate supply in the country this year?
Yes.
We do, okay. Because I know in years past there's been some, maybe the manufacturer didn't make it right or it went bad or something happened. But this year, looks like we're on track to have enough.
Yeah, that's kind of a misconception, and it
Okay.
depends on the flu season as well.
Okay.
They've made some changes over the years to the flu where they can make an accelerated version that doesn't require the use of eggs, that is able to be produced quicker, but also expires quicker. So we need to get it out and get it out there into the community.
Gotcha.
We are able to do that, and that's usually through the trivalent.
Okay, so shelf life on the quick one is short.
Very short.
Okay, but the one made inside eggs, which is, I think, just amazing that we came up with that idea. But that is the one that lasts much, much longer.
Yes.
Okay, in terms of shelf life.
And shelf life, yes.
Okay.
It's generally, we keep it for about a year and offer it all year long.
Okay. You wanted to make sure we talked about complications of influenza, so let's do that. What are some of the
Absolutely.
complications, and who's more at risk? I feel like I'm a relatively healthy person at 45 years of age. That if I get the flu in years past, it's 2-3 days, and I'm starting to feel more like myself again. But there are a lot of folks out there that the flu is just not a good thing to be catching.
No, but it's important for them to get their flu shot as well.
Okay.
What they'll need to do in certain circumstances is always check with your primary care provider.
Okay.
People who have compromised immune systems, pregnant women, and children with asthma. And the children with asthma is especially important because it is a respiratory infection.
Gotcha.
So we don't want, we want children especially to get the vaccination.
Is there an age? Is there an age limit to the flu vaccine?
No, the CDC recommends that everybody 6 months and older receive the flu vaccine.
Okay.
We have a screening process that goes through your allergies, your secondary, any medical conditions you might have, and then proceed from there.
The elderly too. Why?
Absolutely. The elderly are more at risk. They, they are often already have secondary conditions, such as maybe heart disease, diabetes, things like that predispose them to these.
Could the flu kill you? Let me ask you that one.
Yes, it absolutely could.
Okay.
And especially those with asthma.
Okay.
It's very. And immunocompromised systems, because the flu could lead into one of the worst side effects is pneumonia.
Okay.
And
you hear that a lot about how pneumonia. Somebody had the flu, then all of a sudden they're in the hospital with pneumonia, and then they're just gone. And
yes, and when you're in there asking for the flu shot, there are pneumonia vaccines.
Oh, there is?
There is.
Okay.
So when you're in there getting your flu vaccine, ask for the pneumonia vaccine as well, if you're in that risk category.
Oh, I didn't know we had a pneumonia vaccine.
Absolutely.
Oh, okay. Look at that. You're teaching me all kinds of stuff today. All right. Wow. Okay, so flu shot clinics are going to start in October. You said there's 11 or 12 across the county.
Yeah, about a dozen.
Okay, and David McAtee's really good about sending that stuff out, so once he does, we'll start talking about that. And then this is going through April, is the flu season.
Yes.
Okay, so that's complications of flu. Maybe we can before we hit our next break, maybe we can talk a little bit about how can I avoid getting the flu? I've been immunized. Is it still possible if I got the shot, the immunization for the flu, is it still possible for me to catch the flu even despite the fact, can I just be willy-nilly, not wash my hands and hang out with sick people and be okay?
Yes, by all means.
Okay.
But actually less than 1% of the population who get the flu vaccine get the flu.
Okay.
But you still need to follow those tried and true prevention measures, and that's washing your hands for 20 seconds at least. If you don't have access to soap and water, use the alcohol-based hand sanitizers.
Okay.
What we teach our children is to always cough or sneeze into the elbow.
That was new. That was new with the H1N1 in 2009. It seemed like all of a sudden that popped up, because I remember just cover your mouth. But
yes.
H1N1, it became cough into your elbow.
Yeah, they've actually been teaching school children that for quite some time.
Okay.
It just got more, it was promoted more during the H1N1.
Oh.
And so, yeah, you'll see this whole younger generation into their sleep.
Yeah.
So I'm looking for the sleep tissue box to be invented.
Right, yeah, a little zipper here where you could pull them out. Okay,
Most
all right.
definitely.
That's interesting. Okay, so wash your hands, real basic stuff.
It's wash your hands, stay home when you're sick.
Yeah, keep spreading it.
Absolutely, because you are, again, able to shed that. As long as you have a fever, you need to be 24 hours fever-free before you want to consider really kind of venturing out and, not giving it to anybody. Because you want to protect yourself, you want to protect your loved ones, and you want to protect the community.
24 hours. So when your fever's gone for 24 hours straight. And
that's without taking anything over the counter.
Okay, anything that would suppress the symptoms?
Tylenols, aspirins, things, those sort of things. So, when you're without that for 24 hours, that's what we consider safe as far as public health.
YavapaiHealth.com, phone number 583-1000. If you go to Yavapai County's website, if you click on the health department there, it's got all the local phone numbers for you on there. Cherry Beret is in studio today with the Yavapai County Health Department. I'm Paul David. We'll be back in just a couple minutes.
We finally bought a place.
You seriously have enough saved to do that?
We've been putting a little aside each month.
So at the end of the month, we have nothing left to save. How is my account overdrawn?
When it comes to financial stability, don't get left behind. Get tools and tips for saving at feedthepig.org.
Good one, son.
Last summer, my new dad took me on vacation. First, we went deep sea fishing.
Wow! I'm so proud of you, son.
And then we went on Thunder Shark. That was awesome! Let's go again. 3 times. I gotta say, It was pretty cool.
You don't have to be perfect to be a perfect parent. Thousands of kids in foster care will take you just as you are.
Oh, not again.
Cook foods to the right temperature using a food thermometer. 3,000 Americans will die from food poisoning this year. Keep your family safer. Check your steps at foodsafety.gov.
Traditional light bulbs actually generate 9 times more heat than light. Let's switch to Energy Star light bulbs and stop burning through cash. Saving energy saves you money.
A single ember from a wildfire can travel over a mile. You can't control where it will land, only what happens before it does. Visit fireadapted.org to learn how to protect your community from wildfires.
There's a shelter pet who wants to meet you. Meet one today. Visit theshelterpetproject.org. Adopt.
Welcome back to Countywide. We've got just a couple minutes left in the program. Cherry Varay is in studio with the Yavapai County Health Department. We're talking about the influenza shot, which is coming up very close. You said clinics are coming up in October.
Yes, sir.
I got a little story for you.
Okay.
Years ago we did this show, and I actually got the flu shot on camera. And a few days after that, for the next few days, I should say, I just felt awful, and I felt like I had the flu. And Kyle and Dr. Goswami talked about this a little bit during the last show when she was in. But go ahead and explain that to me. Did I have the flu? Did you give me the flu when you gave me that shot? Which you didn't do it, but...
No, I personally did not do that.
Because it's always made me a little hesitant about getting a flu shot because I felt like, well, I got the shot. It's not supposed to give me the flu, and then here I've got the flu.
No, it's a very good question, and it's a very common question and common misconception.
Okay.
It's with any vaccine. Your body is mounting an immune response to something that's foreign. So it's building up the antibodies to fight this off later.
Okay.
So you're going to get...
it's creating an army within me.
It basically is.
Okay.
It's replicating and creating this army. So you are going to be safe when the flu actually does come.
And you said that to me before we got on the show. And I remember as a kid, I grew up on a small farm, and I would get a nail stuck in me somewhere, and I'd have to go down to the doctor, and he'd give me a tetanus shot, and then I would just feel so down in the dumps and drained for a few days. And then I feel fine again.
Absolutely. And that's, again, that's your body mounting an immune response and preparing it, to meet this basically the flu in person. We're giving you an inactivated form of it, and once your body meets the live form of it, it's going to be able to combat that.
Oh, we do. All right. Well, that's a really simple answer. YavapaiHealth.com. Good place to go for information on this, right? I'm sure you guys will have all that, the clinics and stuff posted once they're available.
Absolutely.
583-1000 is a phone number you can have, but if you go to Yavapai County's website, if you click on the health department, there's local departments at Prescott Valley, and Cottonwood. So there's local numbers you can call, and there's clinics set up in each of those locations, right?
Yes.
Yeah, okay.
We have three clinics and 5 nurses that man the immunization clinic.
Now, is this going to be an appointment thing, probably?
Yes, we actually prefer you call and make an appointment. It makes your wait time less, and we already know what you're coming in for.
It's good to have your insurance information with you, probably immunization records, any health records you may have that need to be taken into consideration. Okay, all right.
Yes.
So, do you think we hit everything so far?
I think so.
Kind of a punch list. All right, Cherry Varay, very nice to meet you. Thanks for coming in.
Thank you very much.
That's today's Countywide. I'm Paul David. We will talk to you again next time.